that the desire to palpate something that you have a preconceived notion of is probably the worst thing that can affect your palpatory ability. So if you have a preconceived notion of what you're supposed to feel, you're going to try to look for what you're supposed to feel as opposed to what it actually feels like. If you're taking a deep muscle, the muscle is not going to be as pedunculated as a superficial muscle. What's pedunculated? If I take this and I say that this is a muscle looking head on, okay? If we're doing a superficial muscle, the connective tissue covering the muscle will do something like this. So that's a pedunculated structure. It has a stalk which is narrower than the actual structure itself. So when I go to palpate this structure, I have very deep epimysial grooves. I'll be able to strum it very easily. Okay? A muscle that's deep, let's take the one that we're doing now, people know what it looks like in their brain. In their brain, they've seen it in a dissected picture, so it looks like a tubular structure. Correct? But when you're palpating it, remember, the deeper you go, the more connective tissue overlies this structure. So where a superficial muscle is very pedunculated, a muscle that's slightly deeper will be slightly less pedunculated. A muscle which is very deep will look like this. It's not pedunculated at all. So I'm not feeling necessarily for the ability to strum it. I'm feeling for the bulge that represents it. So when you're feeling a suboccipital, for example, you're not going to feel what an inferior oblique looks like. An inferior oblique looks like a tube. That's how you know it, because that's how it's been drawn for you. And when someone takes the time to dissect out all that unimportant connective tissue, that's what you're going to get. But in reality, when you're feeling an inferior oblique, you're just feeling a bulge, which represents the inferior oblique. Okay? So this concept, you have to bring this concept with you. If you have a preconceived notion as what you're supposed to feel, it's going to make you err when you're actually trying to feel it.